Hello, all. I'm Dr. Walter, working in SNS College of Physiotherapy as an assistant professor. So today we are going to see a case study video regarding the biomechanics of the hip complex. So before entering into the case study, let me introduce my student, Mr. Manuel, from third year of physiotherapy. So today, this hip complex, what is hip complex? So basically we are going for many n number of works day to day life. So we are doing n number of activities into our daily activity living. So what is the usage of this hip complex? So how much weight distribution is happening in this area? So now we are going to do a practical demonstration for the hip complex. Please stand down. Now, Emmanuel is standing onto his both of his lower limb. Now, look at his lower limb. Both the feet are placed onto the ground. Now, I'm making him to stand onto the one of this lower limb. Stand like this. Now, look at his leg. One leg, that is his left leg, is onto the floor and his right leg is onto the upper portion. So we are giving certain names for this area. You can drop this leg. For the leg which is onto the floor, that is called as stance space. The leg which is onto the air area, that is called as swing phase. For example, if he is going for a hopping and these activities which we have done in our earlier stage, like in childhood and all, hopping games and all. If you are going for the hopping and all, one leg will be onto the ground and one leg will be onto the air. Now go for a hopping for a starting stage. Good. Turn around, come forward, stop. Now you have seen the hopping video which we have done in our childhood stage. So I'm going to tell what biomechanics is acting onto this area. So this fellow, while he was hopping, his total weight will be around 60 kg. This is an assumption. Now this 60 kg, normally if we are standing like this 60 kg will be going for partial. That is, will be differentiated. 30 this side and 30 that side. When he is going for a double limb support standing. When he is going for a single leg support, that is swing phase. One will be going for stance and one will be going for swing phase. In this condition, the 60, that is his total weight, will be distributed the maximum onto the stance phase area, that is the leg which is standing onto the floor. What about the swing phase area? In swing phase and in stance phase, his 60 kg weight is distributed. The maximum kg weight is going for the stance area. Now you can drop your leg down. Now what will happen in the swing phase area? So if this leg is going for the swing phase, only a little of weight will be going for this area. So how this is calculating? How we are calculating? As a physiotherapist, we need to calculate certain calculations based on the biomechanics. Head, arm and the trunk. Okay. Now head, arm, trunk of 60% of weight is going for the femur bone. So what is femur bone? It is the longest and the strongest bone in the human body. And which part of area the weight is distributed? The weight is going for the head of femur. So this is for the stance phase from head, arm, trunk. This is the combination. So what about the remaining phases? The remaining phases is going for the ground reaction forces. What is ground reaction force? Ground which we are standing. So now currently I am standing and my student is standing on a tiles. So if we are going for a sand or if you are going for a concrete, the GRF, that is a ground reaction force, is completely going for a reverse technique. So based on the material on which we are standing. If you are standing on a soft foam area and if you are going for a complete marble granite, these will be different. Now, ground reaction forces, how it is shifted. From the ground, the weight will be going upwards and it will be going for the shaft of the femur. Where is the shaft? Look. So this area, this complete area will be going for the shaft area. So head is holding the head, arm, trunk, weight. GRF will be holding the shaft. Now, so on this area, we are having a zone of weakness. What is zone of weakness? Head is having the 60% and shaft is having a ground reaction force 10. In between the head and the shaft, we are having a neck area. What is the neck? In femur, we are having a neck. So in this area, neck is called as the zone of weakness. So why it is called as zone of weakness? For example, we can consider a elderly patient. So previously I have seen a elderly patient in a home visit. So while she was walking, she fell down and she had a fracture at the femur. So this fracture is completely going for the neck of femur fracture. What will happen and how this happened? Neck of femur fracture is due to the zone of weakness. Both the force, head, arm, trunk force, on to the other side, GRF force. Both is acting on this area and the zone of weakness is going for the fracture. So while we are walking, while we are running, all these things we need to remember. So for this, we need to take some calciums and that is naturally available from the sunlight and also from the food habits. We need to take the milk, egg and also the greeny vegetables. So these types of things will be helpful to avoid these types of fracture. And thank you. We'll meet on next video on a different complex. Thank you all.